Hi everyone, hope you all are doing fine. So today's point of discussion is one of the commonest queries which is put forward to me by in the OPD. The topic is diabetes reversal, whether it is possible or not. So let's see whether this is just a hype or there is some reality to it also. This is Dr. Sharad Vedi. I am working as a consultant physician and a diabetologist based at Gurgaon. So if I talk about is it possible, it is yes in the short run and no in the long run because it is tough to maintain. Why so? Because diabetes is a slowly progressive disease which develops over a period of days to weeks to months and years altogether. This is not a single day event. So if the blood values are above a certain range, then it is categorized as diabetes. It is one of the silent killers of the world, because it eventually affects all the important vital organs of the body. So reversal can be fruitful at any stage, but before the complications set in. Once the complications have set in, there is no point in chasing the number because the damage has already been done. So a little bit about science behind this. So there was one very large trial, direct trial, which was conducted, in which it was seen that if patients lose around 15 kg of weight, then they can technically go into a stage of remission, which is HbA1c of less than 6.5, fasting of less than 126 over a period of at least 3 months without any medication. See, only lifestyle changes help and no medication support is there, then only we technically call it as a stage of remission. So now we know that there is science behind this. This is something doable as well as beneficial. So who should attempt it? Whether it will benefit everybody or some subset of patients. See, technically speaking, it may not be helpful in type 1 diabetes and very lean people. So who will get benefit? Recently diagnosed type 2 diabetes, or maybe very short duration of history of type 2 diabetes, patients with pre-diabetes, or maybe with metabolic syndrome. They will definitely get benefit from this. Now second question comes, when to do? So idea is that you should attempt reversal as close to the diagnosis as possible. If somebody tries to go for reversal maybe after 7 to 10 years, then the fight may not be that easy and results may also be not that promising. And one important thing is, it is tough for persons who are at extremes of age, like children and elderly. It may not be very practical for them and may not be easily doable for them at this stage. So how to achieve it? See, very simple idea is they have to go for aggressive weight loss, aggressive weight reduction, whether it is through diet and exercise or through any weight loss surgery. If I talk about diet and exercise, see, all the diets, whether it is low calorie diet, low carb diet, keto diet, very low calorie diet, or maybe paleo diet, or maybe any XYZ diet, all of them are helpful in the short run. But the problem is they are non-sustainable and the body also adapts to new diet regimes, so these all fail in the long run. But yes, if one has to attempt a remission, attempt a reversal, then these are definitely helpful. Talking about the benefits, if somebody goes into a stage of reversal now, so what will be the benefits? Benefits are immense. So one is, obese person will lose weight and reverse their insulin resistance or decrease their insulin resistance. One can reverse the diabetes, whether it is temporary or permanent, that will be a question. And there will be improvement in fatty liver as well. Diabetic persons can altogether cut down the dose of tablets as well as insulin. They may be able to quit it also. So in a nutshell, what we have talked about, whether it is possible, how it is possible, if there is any science behind this, and what will be the benefits. But there are few reality checks also. Let's discuss them one by one. So reversal looks like the disease is totally gone. Nobody talks about whether it is temporary or permanent. See, I will explain this with an example. Let's suppose somebody wishes to lose weight and actually loses weight. Is it permanent? No. Lifestyle changes will lifelong efforts are required to maintain a similar BMI, to maintain a new BMI, as it is the tendency of the body, right? The sugars behave in a similar way. How can it be permanent then? if you start normal carbs, eating normal carbs and eating all the junks, you will eventually get back the sugar numbers where you were at the baseline. Because you cannot change your body or your genetics. So this is a permanent, so the efforts have to be lifelong. So reversal is mostly temporary. In rare cases it could be permanent also. So does that mean achieving reversal is not a good idea? Of course not. It is one of the best idea. You should. But who will benefit? Especially those with high BMI, with uncontrolled diabetes, okay, with pre-diabetes, they will definitely get benefit out of it. So if situation allows, attempt and reversal, that will be a good idea, okay. But I would suggest that take a more longer time horizon of at least 5 years. If you try to achieve reversal for maybe 3 to 6 months and then go back to the previous regime, that may not be very fruitful for the body, because such kind of sudden fluctuations can lead to decrease in immunity, alteration in metabolism, micronutrient deficiencies, as well as can precipitate cardiac disease in some. So if you want to achieve reversal, think long term, not a short term goal. Another point is whether this claim of permanent reversal is true or false. It is probably false, as we saw in the weight loss example, that one has to keep up lifelong efforts. So next time if somebody claims reversal, just ask them whether it is temporary or permanent. I am sure you will be able to judge them better. So monitoring is very important, as it is a dynamic number. Even if you achieve reversal, keep a track on the sugar values maybe once in a while. So what we have discussed as of now is that one, reversal is possible. Subset of patients will benefit from reversal. It is probably temporary. You will have to keep on all the efforts. It is not like that once you achieve reversal, the disease is gone from your body, because you cannot change your own body as well as the genetics. Monitoring is very important. Monitoring is very important. Even if you achieve reversal, keep a track. Otherwise, you may even overshoot the baseline when you started after few months. So that is in a nutshell. But yes, if you feel like you should attempt a reversal, but think long run rather than short run.